afternoon, and thank you for joining us today. My name is Morgan Arwood, and I am the Membership Director of the Midwest Roofing Contractors Association. We are excited to bring you this timely and important webinar hosted in partnership with Apollo Health Insurance. As we approach a new year, now is the perfect time to rethink your health benefits strategy to ensure your company is ready to attract and retain top talent, navigate industry trends, and to make the most of your benefits budget. By the end of this webinar, you'll walk away with actionable strategies to position your business for a successful 2025. I would like to introduce Brett Genrich and Mark Gilmore of Apollo Insurance as our presenters for today's webinar. Thanks for taking the time to be here with us today, guys. Let's dive in and get ahead of the curve.
Thank you, Morgan. We're super excited to be here this afternoon. We think we have some valuable information that can help you address what we think is going to be a growing concern and something that's probably not going away anytime soon. But we're excited to make the connection with Midwest Roofing Contractors Association, the relationship we've developed with Bob, Morgan, Valerie, and Megan. It's something that we've been looking for ways to get that message out to you and give you resources to try to address this problem. A little bit about Apollo Health Insurance. Apollo, we like to describe as a family business that blew up. My parents, Scott and Barbara Eckley, started the business back in 2012. Very quickly, Apollo was on a rapid growth pace. In 2016, we were recognized as a top insurance brokerage, one of the fastest growing businesses in Kansas City. Things kind of took off even more from there. We were recognized nationally in Inc. 5000. As a nationally ranked fastest growing business. We received recognition through the Kansas City Business Journal as a champion of business. That happened 3 consecutive years, and then they time limit you and they transition us over to what they refer to as their Hall of Champions of Business, where we remain. We're located just outside of Kansas City in the Lee's Summit suburb. Today we have over 75 employees. A little bit about Brett and I. I will start, and then I'll let Brett tell you a little bit about himself. My background is in the legal world. I was a trial attorney for 22 years, enjoyed my legal practice, but I spent most of my time cleaning up problems after the fact and looking retrospectively on a set of facts that I didn't get to help create. What I have enjoyed most about transitioning over into the insurance world is the ability to look prospectively, address problems before they happen. And in that vein, that's a lot of what I'm going to do today. So one of the adages I use with my clients all the time was, I'm here to kind of tell you what you need to hear, not necessarily what you want. There's going to be a little bit of that today. I think it's very important that you walk away from this webinar knowing the landscape of healthcare and what you can do to try to curtail rising costs. Brett, I'll let you tell everybody a little bit about your background.
Hey everyone, my name is Brett Genrich. I'm the marketing operations manager here at Apollo. I'm from the Chicagoland area and now reside here in Kansas City. So I'm very familiar with the Midwest. And so I'm grateful to be here today. A lot of my background is in marketing and digital marketing. And so I help the team here just navigate touch points with all our clients and future prospective clients, making sure that anyone that comes to or through Apollo just had the opportunity to get serviced really well and to be just really be positively impacted with their time here at Apollo. I also help manage and navigate a lot of our strategic partnerships. And so it made a lot of sense for Apollo to partner with MRCA with the amount of roofing businesses and roofing individuals that we're able to help service. This was just a really natural fit for us. And so we're just really grateful to be here today and to present a lot of the educational info that we have in store for you all today. So Mark, I'll pass it back to you to talk a little bit more about Apollo.
You'll see on the screen in front of you that our mission at Apollo is to positively impact people's lives. And what I would say to you here is that everything we do, we look through that lens. I think it's important that you are not just hearing from your broker once a year during open enrollment. We thrive on relationships. It's important for us to get to know the businesses we serve. It's important to know the ins and outs, your struggles, your successes, and frankly, touch base with you throughout the year multiple times. We can make sure that your plan is working effectively for you, working the way you think it's supposed to work, and we can together make sure that your health care coverage is the way it needs to be. You'll see that we are a little bit unique. Most brokerages that you're going to encounter is they're going to kind of specialize in one of the areas that's on the board in front of you. At Apollo, we have created what we call a full service situation. Our business started with individual under 65 private insurance. So, what you would traditionally think of for somebody who's under 65 and the different options that they may seek individually for health coverage. You'll notice in the middle of the screen that we have a division for ancillary products. Those are things like cancer policies, ambulance riders, accident policies, which would be very critical to your industry. Um, so we're able to not only supplement just health coverage, but dental policies, vision policies. So there's a whole division at what we call supplemental products there. The top left is our group, or what we sometimes refer to as our employee benefit side. Those are your traditional group policies that many of you are probably used to working in. We'll look a little later at the different types of those. Brett's going to walk through basic differences between those. But we're able to service based on what works for your company. We're not captive to any one carrier. We're not selling any one product. We sell them all. We deal with them all. So we're able to look at what works best for you. In the bottom right of that screen, you'll see Medicare. That's what you will traditionally see referred to as 65 and up. It also covers people who are disabled. So if somebody has been disabled for 2 years, they are able to take advantage of Medicare policies as well. We have a whole team that's able to take care of that transition when somebody ages in to Medicare. And so we're able to service someone throughout their life. And then the bottom left, you'll notice life insurance, another integral part of the services that we offer. Another thing I don't want to miss, and that is unique to Apollo, is we have an in-house claims team and a customer service team. So again, those brokers that are selling you a policy during open enrollment and then you don't hear from throughout the year are really doing you a disservice. We have a team that's going to check on you. We're going to make sure we're getting your cards to your employees. We're going to make sure that that plan is working the way it's supposed to. Our in-house claims team is going to go to bat for you. So we know that insurance is a lot like reading another language that none of us are familiar with. We're going to take over that for you. We're going to try to increase your bandwidth where you don't have to do that. You can rely on the team at Apollo. We'll go to bat if a claim for some reason is not covered. You don't have to deal with those, bewildered calls from your employees. Brett, I'll let you expand a little bit on our teams.
Yeah, I think it's just really rare that brokerages have in-house claims teams, someone who will go to bat for you. And so I know that just serves a lot of people really well, and we can take a lot of the weight of what claims are off their shoulders and really service for them. And that's what our customer service team is here to do. They're here to answer any questions, direct you anywhere. What also makes you Apollo unique is that we have a Spanish speaking department. And so we have a whole team dedicated to that. They also travel for on-site enrollments. So if you're a business that has many Spanish speakers, our team will travel just about anywhere in the country to help enroll you, but also take any calls, any services. That team is always ready and available for any of that. Just like we're going to walk through with you all here today, a lot of educational info. We like to get that out to a lot of our partners as well as a lot of our current clients. We like to send out, hey, how is the health insurance industry impacting you, or how's the roofing industry going to impact your health insurance? And so we like to get a lot of that email and information out to you. Something that also makes Apollo unique is that we have an in-house marketing team. And so a lot of what we've done for a lot of our partners or for, a lot of those who have businesses in the roofing industry, we can make landing pages, websites. We've made an app for a group that we've worked with before. And so with our marketing and tech team, I think there's a lot of opportunities that we've seen. Mark, would you expand in anything else in that area?
The only thing I would reference is it's very evident to us the need for us to do as much of that lift as we can. We obviously want you to be intimately involved. We want you to service in any way that you want to, but we're also aware that you've got many other areas that you're servicing and need help with. So we're going to step inside. We're going to create those landing page, create the apps, create the marketing material for you. Make sure that what's in front of your employees are the things that they need to hear about.
Mhm. So true. We're here to take the work off your shoulders. And so, a little bit of what we're looking at for the rest of our time here today. We know you are here to get handles on, to get ahead of the curve for 2025. What can you do to really benefit your company and your employees or yourself as an employee? And so, we're going to look at the current landscape of healthcare in America today. We're going to drill down further into the families in America. How is that even impacting the spouses, dependents, or the kiddos in this space? And then we're just going to look at 2025. What's the outlook on the roofing industry for this upcoming year? And what can you do specifically to really positively impact your own business or your own family? And then we're going to take a look at how people have done that in the roofing industry so far. What are new strategies? What are some success stories that those in the roofing industry have seen? And so I'm going to flip it over to Mark. Mark's going to walk through a lot of the data that shows us of the current landscape of healthcare in America today.
Yeah, let's dive in. I'm going to apologize up front. I've already explained my litigation background, so we're going to have a lot of exhibits with data. I think it's an important piece, though. I think you need to have a full understanding kind of what you're dealing with when we talk about healthcare. You'll notice in our first slide, a lot of this data comes from the Kaiser Family Foundation. They are an independent, nonprofit, nonpartisan foundation who's done a lot of great studies to really illustrate where we're headed with healthcare and health coverage. The first graph you'll see is that it's answering how easy or how difficult it was to afford healthcare. And you'll note that over half of America believes healthcare is expensive, and 1 in 4 adults have skipped getting healthcare they need due to the cost. So 47% of people found it somewhat or very difficult to afford healthcare costs. As you can imagine, when the party's uninsured, 85% found it difficult. Many of you have a diverse workforce, and you'll notice that number goes up. For Hispanics, 65% have found it difficult or very difficult to afford health coverage. As you also would imagine, as your income is reduced, so those less than making $40,000 a year, 70% of people find it difficult to handle healthcare costs. And when that salary is 40 to 89,000, it's still at 49%. So again, half of America believes healthcare is expensive. Our next slide shows us that 50% of Americans would go into debt if an unexpected medical bill occurred. What they did is they looked at how adults would deal with an unexpected $500 medical bill. You will note at the top bar graph there, the dark blue line would indicate who's not able to pay a bill at all. The lighter blue would indicate who's going to go into debt to pay that bill. So what we learned from that top slide is that 49% of Americans would either not be able to pay a bill at all or would go into debt to pay the bill. Those numbers climb when we look at women. It goes to 57%. When we look at the incomes of less than $40,000 a year, 79% either couldn't pay the debt at all or would go into debt. And that number is still at over a third when we're looking at those making over $40,000 a year. Again, the numbers increase when we're looking at the Hispanic population at 66%. So I don't know when those of us on this webinar have last been to the emergency room, but $500 barely gets you through the door of the emergency room. I spent a lot of time looking at bills. I would point out this simple fact. A mucus recovery system is something you see on a bill. And for those of us who don't look at those all the time, that's a Kleenex. Average cost of a Kleenex in the emergency room right now is $8. Our next slide shows us that 4 in 10 adults have medical debt as a result of medical bills. So 24% have bills that are either past due or they're unable to pay. 21% are paying overtime or direct to a provider. 17% owe that debt to a bank, a collection agency, or a lender. Another 17% are putting that debt on a credit card, high interest, paying it over time. And 10% of people owe that debt to a family member or friend. As part of my litigation practice, I worked in the bankruptcy arena. I can tell you firsthand, there are studies that give these statistics, but over 60% of people who seek relief, bankruptcy relief, it's due to medical debt. So this is something that is unfortunately not going away. It's something we have to pay attention to if we want to address the problem.
Yeah, I would love to talk to the 50% of those who think that health insurance in America is affordable and see how that is going for them. And so I know when it comes to the healthcare landscape, the landscape of healthcare in America, you also have to think about the families because even your employees and employers are not just trying to support themselves, but they're also many times trying to support their kiddos, their dependents at home. And a lot of the times, as Mark alluded to, many of us don't really understand the health insurance jargon in America, and it's really hard to seek alternative health insurance options or solutions when it's really complicated and it's hard to seek new solutions for yourself. And so many families just kind of ride the wave of the offers and health insurance options that are just given to them, or they don't seek out health insurance solutions at all. And we'll go into some data about that later. But so Mark here is going to go through some data that shows what is the landscape of healthcare for healthcare for families in America, and how can we positively impact even the families, not just the employees.
Our key takeaway from this slide is the amount that families spend on health insurance is increasing more than their paychecks are increasing. This study is represented by some lines on a graph again. Our dark black line, our purple line, is our increase in workers' earnings over the last 10 years. That increase is at 45%. The light blue line is representative of overall inflation, which has increased during that same time at 32%. The orange line represents the increase in the cost of family premiums at 52%. And the yellow lines show deductibles that have increased at 58% over that same time period. So you don't have to have a finance degree to see a 45% increase does not cover 142% increase in cost. We're just not on a sustainable path. The old days of waiting to open enrollment and getting a new group quote, doing what we will sometimes refer to as the BUCA shuffle, which Brett will explain a little later, just doesn't work. You've got to pay attention. You've got to be ahead of the curve. Our system, unfortunately, is broken, and it will bankrupt your companies if we don't look at ways to do damage control. Our next slide shows us that the cost to cover family coverage premiums are historically increasing at a rate that your workers' earnings and inflation are not. Again, quickly, the dark blue or black line is representative of inflation. The workers' earnings increase is represented by the green bar, and the family premium increase is represented by the purple line. This is very familiar to the last slide, but we're looking at increases on a year-to-year basis that go all the way back to the year 2000, so the last quarter of a century. And I think the key takeaway here is that you'll note that in the last quarter of a century, there was 1 year where the earning increase for your workers outpaced the family premiums. That year was 2022. For those of us that may not remember, the Inflation Reduction Act came out in 2022, and we had almost $500 billion injected into increased tax revenue and reduced healthcare costs. Next, I want to point out on this slide that family coverage premiums are increasing at a rate that's superior to your individual single coverage. Many of us, many businesses are trying to cover the worker individually. Unfortunately, most families need coverage as well, and that cost is expanding and increasing at a rate that's just far exceeds covering just your worker. This looked at the difference every 3 years since 2000. and the difference in cost between single coverage and family coverage. Well, let's just take the last year in 2024. You'll note that the cost for covering a single person with premiums is $8,951. When you look at covering a family, that number increases to $25,572 annual. Those costs are static. Those are regardless of income. That's the amount it's going to cover, the cost to cover your family. One thing you'll notice from this slide is that gap has widened each and every year that they're reporting. I promise you that when we look at things in your industry specifically, it's not any different than what we're seeing nationally. But what we're going to do now is look at some facts that directly correlate to roofing companies.
Yeah, and so we want to take a pivot here and take a look at what is on the coming up in 2025. What is the outlook for the roofing industry? How does the roofing industry and the health benefits industry kind of overlap, and what does that mean for each other, and how can they help one another out? So what are roofing companies seeing in this upcoming year? And so we took a look at some of the top concerns for roofers and the roofing industry in 2025. And the number one concern is the rising interest rates and financing. And we just know as interest rates continue to increase, roofing companies will face higher costs for loans, equipment purchases, capital investments, and really that just impacts cash flow overall, making it just harder to expand operations or invest in new or greater workforce solutions. And even in a loom of any potential economic downturn, that just really threatens any project demand, any revenue, leading to budget cuts in hiring and benefits. And we know when there's budget cuts in hiring and benefits, that is critical for workers' retention. When you're cutting in those areas, that's just threatening any level of really great retention within your own business. And something that's directly impacting the workers in 2025 is what we're seeing is just a direct increase in wages. So the increases in wages, benefits, taxes, a lot of these for many companies are growing, maybe even sometimes faster than companies' profits. And so a lot of businesses are just pressured to pay more for labor while also balancing other financial demands that are in their own within their own company. We also know that labor shortages, we're going to talk a lot about that, have become a long-term problem, just making it difficult to find quality workers to meet project demand. And a lot of times that leaks into just the work quality. Companies are struggling to find workers, but also like really secured and dependable labor, kind of leading to just increased quality control issues. Last one here is just material costs. Rising costs of material have just compounded on everything that we just mentioned, just really compounded on the financial pressure that roofing companies feel, leaving really fewer resources for companies to invest in. And we even took a deeper dive into, this is a study that even just came out the other week, top commercial roofing challenges in 2025, very similar to what we're seeing overall. But if you drill down into commercial roofing specifically, lack of qualified workers is the first concern. Any economic downturn or inflation is the second. And then again, rising costs of material and building material is the third. And so what is the reality of the roofing working shortages? And so what we've seen is just the U.S. labor force has declined significantly, especially after the pandemic. We've seen 3 million fewer workers participating today compared to February of 2020. And we don't really see this being a short-term issue. And a lot of economists predict that this labor participation will remain low due to just a lot of the factors we see as an aging workforce, health concerns, and changing worker preferences, trying to gear this industry towards the younger generation. And again, we really see this being a long-term impact. Roofing companies are looking for ways to prepare for a permanent labor shortage, and that only increases the competition for really skilled and qualified workers. And a lot of the impacts that we see are things that we've discussed, but delayed projects, labor shortages often lead to projects being delayed, which not only impacts your company's revenue, but also could damage any future relationships. We see quality concerns from these labor shortages with just fewer workers being available, roofing companies may be forced to hire less experienced labor, increasing the potential risk of those projects. Again, we've talked about rising wages being a concern for 2025, and then just hiring concerns overall, the inability to find enough skilled workers to meet any project needs or to really benefit the company as a whole. And we really think that health benefits can mitigate a lot of these challenges by attracting new and retaining a lot of your current most valuable employees. And so here are some of the ways that the shortages of workers, this is what's forcing, how it's forcing companies to adapt. We're seeing apprenticeship programs to get the younger generation involved in the roofing industry. And we're seeing technology integration. While this is a really good while this is really good for 2025, we're seeing new technology come out to to increase productivity and to reduce the need for manual labor. It really doesn't solve the issue for really skilled workers. We're seeing flexible work environments. Companies are looking for new ways just to make the roofing industry more appealing, better scheduling, more work-life balance within the roofing industry. And lastly here, and this is where we're going to try to sit in, but just new benefit packages overall for 2025. A lot of companies are offering competitive benefits, especially in the health insurance space. And this is proven to be one of the most effective strategies to attract as well as retain a lot of your best employers. And we're going to have a lot of cool case studies that show what companies have done and what individuals have even done so far to really benefit their own company to retain some of their best employees and to really positively impact not only their employees, but their families as well, which is a really cool solution. And so I'm going to kick it over to Mark, and he's going to talk a little bit more about how health insurance can really fill a key gap in this roofing industry's concerns for 2025.
What do we know about your industry? We know that 50% of roofers are uninsured. Why is that true? What's leading to that? High turnover rate, many undocumented workers. High turnover in the construction industry is a big reason why many roofers lack insurance. Many workers don't stick with one company long enough to qualify for insurance. In addition, many workers are undocumented. They can't get subsidies through the federal marketplace. Many are living paycheck to paycheck, unable to afford policies in the open market. Brett's going to talk a little later about some solutions that we have that may cover some of those situations. But the bottom line is that half of the roofing workforce lacks health insurance. It's a serious concern, especially given the physically demanding aspects of the job, the hazardous nature of the job. For workers, it means financial insecurity when they're faced with injuries or health issues. It can lead to job dissatisfaction and turnover. So it's something that as company leaders, you have to take a look at. You have to look at uninsured workers and the fact that it may take longer for them to recover from injuries. They may leave the industry altogether, and it creates further strain on the workforce. So providing health benefits is no longer just an added perk. It's no longer just about attracting someone to work for you. It's a way to protect your workforce and a way to ensure consistent project performance. The next slide, how do we address that? How do we retain commercial employees? And you'll notice in the middle of that page in big bold print is that 81% of people responding to this survey indicate that providing benefits is important to them in their job. The only thing that frankly is above it is ensuring a safe work environment. I'd probably submit to you that health insurance complements a safe work environment. But providing benefits exceeds paying well and giving bonuses. It exceeds providing training, and it exceeds ensuring enough work as all categories that lead to employee satisfaction. There was a 2018 study that showed us that 46% of respondents said health insurance was either the deciding factor or a significant positive influence in choosing their current jobs. That creeps up even more, where 56% of US adults with employer-sponsored health benefits said health coverage is a key factor in deciding to stay with their current jobs. So in a competitive labor market, like we know that the roofing industry is, companies that are going to offer strong health benefits are going to attract better talent and reduce turnover. The next slide is going to show you and illustrate a little bit about which benefits drive employee satisfaction. You'll notice in this slide that offering health insurance is a benefit that's 3 times more likely than other benefits to drive employee satisfaction. It exceeds 401ks, it exceeds vacation and paid time off, employee discounts, and maternity and paternity leave.
And so what we want to do now is look at, okay, so we've seen the rising costs in health insurance. We've seen those key gaps that are in the roofing industry, that 50% of roofers are uninsured. What have companies done to find success in this area? And we're going to walk through 2 different ways the industry has found success. We're going to walk through the individual route as well as the group route being the company as a whole. And so we're going to start with the individual route. And so really the question I would just like to pose is, what would it look like for you if you're a small roofing company? What would it look like for you to offer insurance or a resource if you don't offer group benefits currently? Or if you had employees who don't have health insurance currently, maybe they don't think they can get health insurance, maybe they haven't sought health insurance option, yet work the risky job that is a contractor in this industry, where would they go? Would they know who to talk to? These are what we like to walk through for those who are seeking individual insurance. And we typically start off doing a needs analysis, looking at where that employee is at with doctors, prescriptions, networks. And then we'll walk everyone through one of these 3 options. And so this is a really basic level of what is the health insurance space in America for individuals. This first bucket here, we like to call these the 3 buckets. The first bucket here is the ACA bucket. You've probably heard of the ACA bucket before. There's a lot of synonyms that go around in this space, it being Obamacare or the federal market, or some states even call it a state-based exchange, essentially where states are providing these options. What's unique about the ACA is that it covers 100% of all pre-existing conditions, and it's based on income, which is why it's called the Affordable Care Act. And so really spouses or kiddos or your family or your employee will get assistance from the government to help cover these costs. And so that's the ACA. That's the first bucket. The second bucket is the short-term medical bucket. Think about this bucket as someone who's in a really transitional phase of their life. Maybe it's a 26-year-old who's coming off their parents' health insurance plan and that needs coverage for a little bit of time. Or it's someone who's in between jobs, or it's someone who's maybe in a temporary or seasonal job and needs coverage because they didn't get it elsewhere. These short-term plans are great for someone like that. And it even has some great benefits that come along with that, such as out-of-network opportunities. And so this last bucket here is what we like to call non-traditional insurance. There's a massive trend really in America right now for people moving to non-traditional insurance. The most common name for this also is just called a health share. It's really just an alternative to your standard health insurance option or the ACA. These are private options. These are PPO networks. And so they're offered in every state. And really, if you're someone who's a contractor out of Missouri, but you find yourself on vacation in Florida and maybe you bust your knee or hurt your ankle, that's going to be covered because these non-traditional insurance products are all PPO networks. And so you're going to be covered even if you're out of state. Or if you're a contractor going between states, this is a great option for you as well, so that you don't find yourself uncovered if you hurt yourself in a different state that you don't reside in. This is a great option for many contractors that we see, those people who are working between several different states. It's also a really good option for those who are healthier, as these private options will underwrite you to get you into the plan. It's really a cost savings to you based on your health. Another way we see this being really beneficial is for those who don't have a Social Security number. This is an awesome option for you to still get covered with health insurance as well. And so those are, from a high level, the 3 buckets of what we like to walk through and provide options for those who are seeking individual coverage.
Um, this is a case study that we want to share with you. Again, it points out the uniqueness of Apollo. Because we're dealing in the individual space as well as the group place space, we can compare the two. This was a Nebraska roofing company. They came to us from one of our partners, Job Nimbus, who I'm sure many of you are familiar with. Um, they were previously on a group plan. That group plan became unaffordable for them. It was not something they were able to continue. Frankly, they didn't see a path forward. They took a few minutes with us. Uh, they also were frustrated at the limited network of the plan, as many of their workers were traveling to different states. It was a pain point that, frankly, was they were looking at getting out of providing health insurance. What Apollo was able to do was transfer that small group to individual plans. Immediately, that saved them $1,667 a month in total annual savings of $20,000.
And what we're excited to show next is even just a testimonial video from a contractor who was able to get put on a plan. And so this is his testimony after working with Apollo.
I'm Hayden Eatinger. I'm a real estate agent and general contractor. The basic reason I needed health insurance coverage was because I was 26 and I finally had to get off of the parents' plan and find something to support myself. Jake presented multiple options for me, making sure that I wasn't being overpriced for something that I didn't need. The phone calls, it was always a phone call away. My wife actually had to go to the doctor, and we received multiple medical bills from different scans and things that she needed. I called Jake to ensure we weren't being overcharged, and within that one phone call, instead of us having to call around and deal with different claims departments, he was able to figure it out for us. I would recommend Apollo Insurance to anybody who is looking to either start or switch over plans or find something new. The reasons being is because of the community that they have here, because of the open line of communication at any time of the day, whenever you need it, and also the competitive pricing, knowing that whatever I need, I'm going to be fully covered at a highly competitive price.
And so you can see we like to take the work off people's shoulders. We know healthcare, as he mentioned, is complicated, especially when it comes to claims. And so we want to make sure that we're doing that work for you and that you're not lost in the confusion that is sometimes health insurance in America. And so along with the individuals, we also like to benefit companies as a whole. And so what's just like the individual buckets, this is the group buckets. And so this is different ways of the employer providing health insurance to their employees. So the three buckets here, the first one is fully insured. This is probably your most common form of health insurance for many groups. This is your what we like to call the easy button. Has Blue Cross, Cigna, Aetna, some of those larger carriers. And we call it the easy button because a lot of times you can put in your age, where you're at, the industry you're in, the amount of employees you have, and in a matter of seconds, you can get a street price for how much your health insurance cost is going to be. And so a lot of people default to using fully insured because it really is the easiest form of insurance to get. And even before I move on to the second bucket, there really is no perfect solution for everyone. We work with groups every day and we're walking them through each one of these options, and there's different scenarios for every group that makes them unique, that makes each bucket unique and good for their own company. And so just wanted to make sure that was clear that every single bucket can be a perfect solution for a unique group. This next bucket here is the level funded bucket. From the employee's perspective, this doesn't change anything. But from the employer's perspective, this changes based on the health of the employees. So a healthier group just comes with better rates. And so that's what changes for the level funded. If you want more control of your health insurance costs, if you want more control of the data that comes with that, and you know you have a healthier group, this is a really good option for your business to get on a plan that can save you money because you know you have a healthier group, but also you have a little bit more control of your health insurance costs. This last option here is the self-funded bucket. And we like to say really anyone that has a group of 50 employees or more, you should absolutely be on a self-funded plan. And that's because you just get full control of your health plan. I like to talk about the self-funded bucket as a create your own burger stand. You get to add everything you want in your plan. You get to add the pickles, the cheese, the lettuce. I want to hold the tomato. You get to make direct contracts that make up your health insurance plan for your group. And so, we really like this plan for groups who are 50 employees or more, because you get the most control out of your health insurance plan. And your traditional broker would really look at these and they would rank these from riskiest to least risky, as fully insured as the least risky, level funded as a little risky, and self-funded as the most risky. But when you have 50 more employees, we really like to switch that on its head and say self-funded is the safest route to be on, because risk is really just where unknown factors produce unknown results. And with the self-funded option, unknown factors produce known results. And so you have a way better idea, because you own that data and because you made those contracts, how claims are going to affect your group. You also know how much you're going to pay next year and not get caught up in a health insurance renewal premium increase every single year. Because you made those contracts, you're able to control your health insurance plan. And so there's a lot of known results that come with this plan. The last thing I would say is that there's a stop loss. And so when there's a catastrophic claim, there's a stop loss that the carrier comes in and helps you out through the rest of those claims. And so we just like to say that to reduce some of the idea of risk when it comes to self-funded. And so those are the three options for group insurance when it comes to this space.
Thanks, Brett. Our next slide is real live data from one of the companies that we helped. And one thing I would want to highlight from what Brett illustrated there is that if you haven't started learning about level funded plans and self-funded plans, it's important that you do so. Fully insured plans, while they may be a perfect situation for certain companies, you're going to have no knowledge as to why the increase was what it was. So it's important for you to start moving towards plans that give you access to why you're paying what you're paying. You'll notice from this case study that there was a Midwest roofing group that we were able to save thousands of dollars. They were on a fully insured product. We were able to look at a self-funded plan. The total monthly savings was $3,000 a month. Annually, that was $36,000 a year that we were able to save them just simply from moving away from the fully insured product, providing them with more custom benefits and creating a plan that worked for them.
This last case study here is actually a really recent one from this last 30 days, which is really cool. And so we know that your company wants to work with someone who can think of outside the box solutions to your health insurance needs. And so what we're looking at here is this is a painting contractors. And so not essentially roofing, but still a company that had about 30 contractors. And they were paying about $21,000 a month in health insurance costs. And so what we were able to do was look at new ways to how can we take down that cost. And what we were able to do is really put them on something that we like to call gap coverage. And that's really designed to help you cover a lot of the costs that come with health insurance. And so how that benefited them was they were able to save $96,000 a year, all because we were able to think of a solution that was a little bit outside the box, because gap coverage, if you want the Cadillac version of healthcare for your group, but you're not essentially able to afford that Cadillac version, which maybe costs $800 a month per employee, but you have to default to the $300 a month option. This gap coverage actually bridges that gap to help you afford a lot of the costs that come with those costs. Essentially, it covers the costs for you to maintain your plan, such as deductibles and co-pays. But gap insurance really just supplements your primary plan by covering these out-of-pocket costs or expenses. And so their current solution and their current relationship with their broker that they had, we weren't able to save them a lot of money, and they came to us as looking for a new idea of how can they save money, and they ended up saving $96,000 while also improving with new benefits. And so really what we like to ask is what it look like for your company to explore new options that can help you save money like these contractors have saved in the past. And really, to summarize everything up that we've talked about today, we've seen that healthcare costs in America are on the rise, and there's really no end in sight for that. We know the roofing industry is experiencing a massive shortage of workers, making qualified workers more valuable, and wanting to retain a lot of employees. And we see that employee benefits and health insurance for even individuals is the key gap to and solution to attract and retain a lot of your top talent.
In conclusion, you'll notice on our last slide, there's a QR code that links to a calendar. We're not into the game of high pressure sales. What we like to think of ourselves as developing a relationship with you, looking at options, making sure you're educated, most importantly, on what's out there. We'd love for you to link to our calendar, spend 15 minutes with us, spend an hour, whatever you want to allot. Brett, myself, our team, we would love to sit down with you, get to know your company, and look at ways for the future. If you're somebody out there who's chasing storms and you're moving state to state, we think we have a really great product that will provide a solution at a very affordable cost. So many different options, whether it's group or whether it's peeling your families off for individual plans. Call us. We're happy to talk with you. Morgan, we'll flip it back to you. I'm not seeing any questions, but maybe you have some on your end.
Nope, no questions. But Brett and Mark, thank you so much for taking the time to do this. And for anyone who didn't get to catch this entire webinar, we are going to be posting it on our website, so you can find it there. And then if anybody wants to contact Brett or Mark, you can contact me directly or through our website. There's a link there to take you through that. I know when we brought this to our board of directors, they were really excited at the versatility that Apollo offers and how it can fit into anybody's company. And like you guys were saying, retaining talent, which is the number one issue that our contractors are facing is the workforce. So anyway, thank you guys for being here. And I look forward to seeing everybody at our future events, and everyone stay safe and happy holidays.
Happy holidays.
Thank you so much.